Hello, I'm Andrew Whitfield Cook and this is FX Radio. And today in the studio with me is none other than Dr. Michael Murray, a naturopath of great renown and who has a very long history and a very eminent place in naturopathic history, certainly in the United States. And when people realise what will be who this man is, they'll go, right now I understand. So, Dr. Murray, welcome to the studio.
Well, thank you. It's my pleasure.
I tell you, it's my pleasure. I remember when I first heard you speak in 2005, knowing your name, and it was a great pleasure to hear your webinars back then on inflammation and certain products like proteolytic enzymes and what they do for patients. So today we're going to be sort of, I guess, talking a little bit about that theory or that premise of inflammation. So tell me about your use of Theracurmin. What do you think? Why do you think it's so special?
Well, the therapeutic efficacy of any product or drug is based upon delivering an effective dose. And the reason why in vitro studies and animal studies are conducted are to determine what is an effective dose and what are the consequences of that dose.
Yes.
So if we look at the history of curcumin, this yellow pigment from turmeric, in the last 20 years, it's been the subject of over 5,000 scientific investigations. Primarily, these studies have been in vitro and in animal studies. Now, based on the results of these studies, curcumin has been referred to as the preclinical cure-all. It's given that moniker because it's been shown to be effective for so many different conditions. And the reason is that it literally turns off some of the key steps that lead to the production of inflammatory compounds. Curcumin has been shown to block or inhibit the action of every single known inflammatory mediator. It's referred to as a pleiotropic molecule, and what that means is it has many, many sites of action. And when you look at its anti-inflammatory dance, it's absolutely beautiful. This natural compound has significant activity, yet no toxicity. And we'll explain that occurrence. We'll explain how can something be so active and so powerful, yet have no side effects. So this body of knowledge of curcumin is very exciting. But as they started to move from animal studies to human studies, they didn't see the same sort of results. And the reason being is they weren't able to achieve the same level of concentration. For example, curcumin has been shown to inhibit the formation of beta amyloid, which is a key factor in the development of Alzheimer's disease. That was shown in test tube studies. That led to animal studies where curcumin was shown not only to inhibit the formation of beta amyloid, but actually dissolve beta amyloid deposits. So the researchers doing that animal work thought, oh my gosh, we've discovered the cure for Alzheimer's disease. So that led to some human studies. 2 human studies using a very popular form of curcumin failed. Why did these studies fail? They failed because they were not able to achieve an effective dose. We know, based upon the test tube study and the animal study, what the concentration that was required to produce the effect. And trying to achieve that concentration with regular curcumin or turmeric extracts is just not feasible. If you look at some of the work that's been done in cancer, maybe Dr. Ashuler talked about this, one of the detriments has been the poor bioavailability of curcumin. In some of the studies, they used dosages as high as 12 grams. In one study where they used 8 grams, 21 out of 24 people, they were not able to detect any increase in curcumin in the blood. In a study where they gave subjects 12 grams of curcumin, they showed blood levels only increased to about 51 nanograms per ml. based upon studies that have been done and the clinical use that's being conducted at the MD Anderson Cancer Center in Houston, it looks like the target is around 500 nanograms per ml.
That's serum?
You're not getting anywhere. We're near the level you need to get to.
A tenth, yeah.
A dose of 12 grams is only giving you 10% of what you need. So that's not going to translate to very good clinical response.
So tell me what's different with Theracurmin, because I know that, and I said this with Dr. Lise Altschuler, and I'll say it again because we owe a great deal to a company called Sabinsa, who, basically did so much of this preclinical work, and with the dry curcuminoids, even on advanced stage pancreatic cancer patients where they had a huge dropout rate. But some nice actual successes there with those who could continue therapy. But then the industry moved and we said, well, look, we've got to get this stuff into people and, into the tissues, into the target tissues. So there's been this whole jockeying in the industry about each company getting their form, if you like, their slant on a bioavailable form of curcumin. So there's so many out there now that have jumped ahead, but Theracurmin is really one of these that it's ahead of the game. Tell me more about it. What makes it so special?
Well, yeah. First, let me just talk about a recent pharmacokinetic study that was done with the Sabinsa material. Since you brought that up, and they used very, very high doses. And in this study, they looked at the concentration in the colonic cells. So what it looks like is that if you want to just concentrate it in the colon, maybe some of these other forms may have some benefit, but you don't really see any significant increase in blood levels, even at really, really high levels. And people can go to the Medline and they can track down this article. What I'm saying is absolutely true. We can look at pharmacokinetic studies with all of the commercially available forms of curcumin, and when you look at those results and you compare them to the results that are achieved with Theracurmin, there's no comparison. There's really no comparison. It truly is a groundbreaking product. So let me describe what it is. I've mentioned it several times. What they do to produce Theracurmin is they take a very high quality curcumin extract. You know it's high quality if you just look at the color of the capsule. Empty that capsule out into a glass of water. It's brilliant yellow. Curcumin is the yellow pigment of turmeric. And if you look at other curcumin products out there on the market, what color are they? They're orange. They're not as high in curcumin. Now, studies have shown that curcumin exerts the greatest effects. So the other curcuminoids, they may have some complementary effects, but in terms of real potency, curcumin stands out. So they take this high-quality curcumin extract, and then they reduce the particle size. Curcumin is a poorly soluble compound, largely because the particle size is so large. It likes to stick together. The crystals are larger. It's kind of like if they're all big chunks of rock salt. And if you're trying to salt your food, that wouldn't be such a good thing if you dump in big chunks of rock salt on your food. Well, in terms of absorption of curcumin, if we can reduce the particle size, that goes a long way. It doesn't take us the full way. The next thing that is done, and by the way, the way in which they reduce that particle size is through a process called wet mill grinding. So they basically put the curcumin in solution and bombard it so that you reduce the particle size 100 times smaller than regular curcumin powder. So you take that reduced particle size curcumin and then you encapsulate it with a vegetable gum called gum gatti to form what's called a colloidal suspension. I imagine most practitioners know what a colloidal suspension means. Yeah. So it's a dried colloidal suspension that when you mix it in water, it's really, really nice to see. Because if you try to mix regular curcumin in water, it's not water soluble. It just kind of sits there. But the Theracurmin will disperse and dissolve, and it'll be dispersed evenly throughout the solution. Yeah. And it'll form this colloidal suspension where you have equal distribution of the curcumin throughout. And it's not only increased in its ability to withstand heat and light, so it becomes much more stable in this colloidal suspension. So by reducing the particle size, increasing the solubility, we see dramatically increased absorption. So when you create this colloidal suspension, you not only increase the solubility, you also increase the stability, so it becomes more resistant to light and heat damage. Absorption of Theracurmin compared to other forms of curcumin is substantial. If we compare apples to apples and look at blood measurements, one capsule, 300 milligram total, 30 milligrams of curcumin in the Theracurmin will be equal to the absorption of about 8,000 milligrams of regular curcumin based upon the impact on blood levels. So if we look at the absorption studies, again, and we compare apples to apples, Theracurmin is far superior to any other form of curcumin currently on the market. Without question.
And I think this is a key thing to get across to practitioners. And it's something that where practitioners get very confused about because of marketing and jockeying in the industry. And that is that it's one thing to have a certain amount in a capsule, but it's a total other argument to have a response in your patients. And this is what you're explaining about the Theracurmin.
Absolutely. It's not how much you take, it's how much you absorb.
Yeah,
and once it's absorbed, it doesn't matter where it comes from. Now, I'm not saying that other forms won't produce clinical results. That's not what I'm saying. But when we're looking at some of these more serious health conditions, Alzheimer's disease, cancer, severe inflammation, based upon the preclinical studies, it's virtually impossible for many commercial forms to achieve the therapeutic level. Theracurmin is the only form of curcumin that's been shown to produce a dose response. And what that means is the higher you go in the dosage of Theracurmin, the higher the blood measurements.
Right.
With regular curcumin, you reach a threshold. There's not much difference in absorption between 30 milligrams and 3 grams, or 3 grams versus 12 grams. So even saying something is 300 times greater absorbed than regular curcumin that I just said a few minutes ago really doesn't have much meaning when we're looking at some of these clinical indications, because what we're trying to do is achieve specific targets in the blood with our therapeutic intervention, in this case, the curcumin.
Yeah. So can I just ask then, let's talk about the patient. What sort of practice tips can you give the practitioners in Australia for using Theracurmin in patients with, let's say dampening inflammation? What sort of dosage would you use for various conditions? What caveats would you have, like, for instance, if they had gallstones or if they were using medicines, if they had to be cautious about any interactions? What can you tell us?
It really depends in the indication. For example, Theracurmin is a well-studied natural product. It already has been the subject of more clinical studies than any other form of commercially available curcumin that I know of. And more studies are in process. And the reason being is that all of these researchers that have fallen in love with the mechanism of curcumin, they're jumping on the Theracurmin bandwagon. So I mentioned the failure of regular curcumin in Alzheimer's disease. Well, researchers at the UCLA in Los Angeles, they are now conducting a study in Alzheimer's patients with Theracurmin.
Fantastic.
MD Anderson, the famous Cancer Research Center, again, they are looking at Theracurmin in advanced cancer.
Right.
So we're seeing all sorts of really interesting studies in process. There's a study that's been, I think it's been completed now in patients with depression. It turns out that inflammation plays a huge role in depression for a lot of people, and by reducing the inflammation in the brain, you can see clinical benefits. Theracurmin has been shown to be helpful in congestive heart failure, something that people probably wouldn't think about using curcumin. But Theracurmin was effective because it relaxed and increased the tone of the larger arteries.
Right.
So it reduced the peripheral resistance and it allowed that heart to pump more efficiently.
Yeah.
So a significant improvement in congestive heart failure. That study just used a dose of 300 milligrams twice a day.
So can I just stop you? When you're talking about 300 milligrams, is that of the curcumin in Theracurmin or 300 milligrams of Theracurmin?
Yeah, it was Theracurmin in these existing clinical studies has a 10% curcumin content. So 300 milligrams of Theracurmin provides
30 milligrams.
And we know, based upon some of the work that's been done with some of the other commercially available forms of curcumin, a very good work has been done by several companies with curcumin products. Based upon those studies, we get a general sense of what the blood levels are that are required in order to see a benefit, whether we're talking about uveitis with Mariva or osteoarthritis with Mariva, or some of the studies that were done with the Sabinza material or the BCM95. We get an idea of what the blood levels are that are the targets, and we know what dosage of Theracurmin is required to produce those effects. So for general kind of low-grade inflammation and some of these cardiovascular benefits, effects on the mood, some of the range of activities of curcumin that I would put as not life-threatening or serious, the dose appears to be about one capsule twice a day. So 30 milligrams of curcumin as Theracurmin twice a day. I like a loading dose. I like 2 capsules twice a day for the first week or two, and then drop it down. When you look at the pharmacokinetic pattern of Theracurmin, we see that it is retained longer, and there's a second absorption. Curcumin is excreted in the bile primarily, and so you'll see some second peak occur as the curcumin starts working its way out of the body. So with chronic use, we may be able to get by with lower dosages. For severe inflammatory conditions like rheumatoid arthritis or lupus or psoriatic arthritis or any of a number of other autoimmune diseases, I think you're going to have to go to a higher dose, probably in the range of a chronic dose of about 90 milligrams of humanist Theracurmin twice a day. For Alzheimer's disease, I would place it at that dosage. For cancer, the dosage has to be even higher. The dosage that looks like it's effective in raising the blood levels to necessary levels is about 6 capsules twice a day.
Wow.
So I know that that's a lot, but we're trying to achieve a blood level of about 500 nanograms per ml. Hopefully, sometime in the future, we'll be able to monitor the dosage based upon what it shows up in the blood. I think we'll hopefully reach that level of sophistication with not just curcumin, but with other natural products. And we'll really come to realize that there is some individual variation. I mean, right now we're given general dosage recommendations, but there is tremendous individual variation in the absorption of many natural compounds as well as drugs. So, you just have to kind of do your best and adjust the dosage based upon the clinical response.
Yeah.
But in the future, I really do believe that we're going to be basing it on blood measurements. Now, I want to talk about something that I think is really interesting. Earlier, I mentioned that curcumin has this tremendous activity, yet has no toxicity. How can that be? How can you have something that is so profound, has so many different mechanisms of action, yet doesn't have any toxicity? That's unheard of. What's going on? Well, what looks to be the case is that when we absorb curcumin, it is quickly bound to glucuronic acid. So it circulates in the blood in this bound form. Now, at areas where there's inflammation or tumor activity, there's a secretion of glucuronidase. This is the enzyme that can break that bond. So it looks like that curcumin floats around in our bodies in an inactive pro-drug form, and it becomes activated where it's needed.
Wow.
I think that's really beautiful, and I think that's the explanation as to why we don't see toxicity with it. There's no toxicity once it's bound to that glucuronic acid.
Yeah. So it's activated by its need.
Exactly.
Yeah.
I think that's really cool.
That's absolutely. And, I got to say, I think this is one of the main beauties of incorporating natural medicines into therapy is that it's very forgiving. Because we've evolved with these molecules. They're not a new molecule. It's just that what we're doing with things like Theracurmin is making them much more bioavailable. I think that's beautiful. That's a beautiful little example of how this stuff works, specifically with inflammatory conditions. Can I ask, though, so you say it's very safe, but with curcumins or turmeric's and our original use as a cholagogue, would you be a little bit cautious in using it with somebody that might have gallstones?
Well, I know that there's been some concern about its use in patients with gallstones. It is a choleretic, so it can increase the flow of bile. But I think that's a good thing in most people. So I would recommend just starting at a lower dose and working the way up. I think it's much ado about nothing.
Yeah.
I think the real concern with Theracurmin has been its possible interactions with certain chemotherapy agents. It is possible that it may interfere with the activity of certain types of chemo agents, and I don't want to highlight that point. For the most part, you're looking at a large body of data that shows significant advantages with Theracurmin combined with chemotherapy.